Introduction of nursing care in Japan. Nursing care services in Japan provide support for walking, toileting, eating, and bathing to people with difficulties in their daily activities due to old age, mental or physical disabilities, or other reasons. In this video, we introduce the characteristics, service structure, and overview of nursing care in Japan, as well as professions related to nursing care. There are two critical concepts in nursing care in Japan. The first is support for self-dependence. This means not only providing care, but also support that can enable those who require nursing care to make use of their own abilities as much as possible. The second is the preservation of dignity. This means constantly observing whether service users live their desired lives and providing tailored care and support. Next, let's look at the structure of nursing care services in Japan. In Japan, people can receive nursing care through public long-term care insurance by obtaining government certification. Two types of nursing care are available depending on their person's condition. The first is services in facilities or residences, in which patients move into a care facility to receive 24-hour nursing care. The second is in-home services, in which a person lives at home and either visits a nursing care facility or has a home visit from care workers. These nursing care services are provided by collaborating with various people, from inexperienced to certified nurse care professionals, doctors, and nurses. Various people work together in Japan to provide services that integrate medical care, nursing care, and daily life support to create an environment where people who require nursing care can continue living in a familiar community and lead their desired lifestyle. We call this the community-based integrated care system, an essential characteristic of nursing care in Japan. Japan experienced an aging society earlier than other countries and has accumulated a lot of expertise in nursing care that can be used in other Asian countries with aging populations. Since Japan's nursing care aims to enable people to live their desired lifestyle, the concept of support for self-dependence is very important. To achieve support for self-dependence, care workers not only take care of an elderly person's personal needs, but also help them live each day using their own abilities. By maintaining people's physical functions and abilities for daily activities, we aim to prevent them from needing long-term nursing care. Even if long-term nursing care does become necessary, we try to prevent further deterioration of their physical and mental functions and aim for their recovery as much as possible. There are 5 key elements in nursing care for supporting self-dependence so that older people can live a healthy and independent lives in their familiar community as long as possible, while respecting their personalities and lifestyles. The 5 critical elements for supporting self-dependency are ensuring sufficient intake of nutrition and water, maintaining physical functions needed for eating, keeping physical functions required for using the toilet, securing a level of physical activity that is within the person's ability, and identifying and appropriately handling any decline in cognitive function. Initiatives for supporting the self-dependency of older adults are being widely implemented in nursing care settings across Japan. Next, let's look at what types of nursing care are available in Japan. Services available through Japan's long-term care insurance can be classified into two categories. The first is facility or residence services, in which people move into a care facility. The second is in-home services, in which people live in their own homes and either visit care facilities or receive home visits from care workers. These services can be classified further according to the degree of necessary care and its purpose. For example, individuals who require constant nursing care and are not suited for in-home care are provided with integrated nursing care that includes meals, bathing, and toileting at an intensive care home for older people under facility services. An example of in-home services is home visits. A care worker periodically visits the home of older person or others needing nursing care to assist with meals, bathing, and toileting. A care worker also performs household chores like laundry and cleaning. People of various professions work closely together to provide these nursing care services. This includes not only care workers, but also those who provide medical care like doctors and nurses, rehabilitation experts like physical and occupational therapists who support patients' recovery and self-dependency, and those who support meals and daily activities like dietitians and cooks.